What's up, guys? Welcome to Broke and Stressed, a PT student podcast where we talk about our lives as broke and stressed physical therapy students. Throughout grad school, you'll come to find that the struggles that you're having happen all the time to thousands of students across the country. You are not alone. In this podcast, we'll share our personal stories and walk you through how we overcame some of our own struggles. I'm your host, Ruben. Let's have some fun, have some good conversation, and let's get into the episode. Alright guys, hello, welcome to episode 4 of Broke and Stressed. Today we are joined by my classmate, Shar. Say hello.
Hi guys.
So today we're going to talk about first clinical experience that we had together. We were kind of buddied up at a hospital for our first 2-week clinical. But before we get started, Shar, one of my traditions for the podcast is I have all my guests share a embarrassing story from PT school. So if you want to...
Okay, I don't know how embarrassing this is, but I was doing like a practical exam and it was on the shoulder and we're supposed to like talk through like what bones are where and like what we're touching. And I called the humerus the femur. And our professor kind of just looked at me and I was already like so nervous. I was like, yeah, the femur right here and everything. He was like, and I like corrected myself really quickly, but my heart dropped. I was like, oh
my gosh. At least you corrected yourself though.
Promise. Yeah, but it was just like the fact that it came out so sure was, yeah.
Let's start. So we had a different experience than most of our classmates because first of all, we got that email saying, hey, you guys don't have a placement right now. So how did you feel when you got that email?
Kind of disappointed. It just made me feel kind of sad that like we didn't have enough clinicals to go around for everyone. But at the same time, I get it. Like it is hard to find people to take students on for just like 2 weeks. We can only learn so much in that short period of time. So we're kind of like more of a hassle for them than like a good thing. So
Yeah, for sure. At first, it was frustrating. It's like, come on, man, like this is what I'm paying for. But then I realized now that I'm like a couple more semesters in, it's like, oh, I guess it's a lot more work than I thought to like organize all of this. So I'm a little more sympathetic. But yeah, it was frustrating because it's like we got that first email saying, hey, you guys might not have a spot, and then we got the second email saying, hey, you guys are gonna do it after all our classmates are doing it because everyone had their clinicals and then they had our break. But we had the opposite. We had a break first, and we had clinicals when everyone else was going. Kind of frustrating looking back, but I mean, nothing really much you can do.
It really reminds you to be like super adaptable as a student because like you never know what can go wrong in like your education or scheduling or whatnot.
And then now look at everything going on right now. We have to be super, super adaptable because
we are super adaptable,
Yeah. So overall, how would you say your first clinical went? Like, what is your overall thoughts about it?
So we had inpatient, so like acute care. So like the range of patients we saw was people who were kind of like sick, like they couldn't get out of bed or like they hadn't gotten out of bed for so long and they had a million like lines and tubes attached to them. And when you look at them, you're like, there's no way this patient's getting up. So I guess for me, it was like probably one of the most rewarding experiences I think I'll have. I thought it was like the best clinical to learn because like I feel like you learn so fast in inpatient. It's just like you have to know what you're doing or your patient's on the floor and then you're in big trouble. But yeah, what did you think?
Yeah, I agree. Like for PT school, I had zero clue. I thought like all PT was outpatient like sports and I didn't no clue that inpatient even existed. And then we got to do our own inpatient. I'm like, wow, this is crazy. It's like a lot of pressure, but you're right. It is really rewarding because it's like you're helping them. You're able to see their growth so much more than outpatient, I feel like. And you do learn more. Like, I feel super knowledgeable after having that as my first one. So I have no regrets going into it. What do you think you take away the most out of like taking from this clinical to your moving forward into your other clinicals?
I think for me, the biggest thing I struggle with, which is especially since being like in lecture for almost 2 years, is understanding that like your patient comes first and like making sure that you're not just like reading their chart values and thinking like that's that. That was like the hardest thing for me is to like look past the guidelines, look past what's recommended and see like what works for your patient and what do they want out of it. My next one is outpatient. And obviously that's going to be so different from acute. But just understanding that, like, in whatever setting you are, you have to look at the patient as a person. You have to look at, like, what are their wants, what are their needs, and not just like a chart that you're reading or like referral that comes in. I think that's the biggest takeaway for me.
Yeah, for sure. Yeah, we did spend a lot of time in the classroom, and you're learning how to, like, oh, what technique do I do? What's the order of my eval? Like, I have to make sure I get range of motion and I do it correctly. But then you forget that there's a living person sitting in front of you. You know, it's not just their chart, and it's not just like a case scenario like we practice in class. And I think that comes with, I guess, just more time and confidence, just more time under clinical experience. We'll just get better at it. Once you get good at those skills, I think it'll be really rewarding to be able to do all those things at the same time.
Definitely. And I think like we were taught a study where they asked like patients about how satisfied they were with their providers. And it wasn't always the patients that were getting better who loved their providers. Like, it was patients who like had that like connection with their provider, and like they like showed that they cared about them and like had rapport. So I feel like that kind of like ties in where it's like, if you're not centering everything around your patient and making them feel important and cared for, then like what are you who are you treating, what are you doing? So
yeah, and that goes back to also just being like a people person. Like, most of us, I feel like, are people so like we were able to socialize and like interact with people, and we actually care about the job we want to do. Did you have inpatient experience before, like our clinical?
Not really. I did like some shadowing. I used to volunteer at a hospital, but I was in their outpatient center for the most part. And then sometimes, like, if at the end of the day, if there was time, I would go for like an hour with a therapist and get to see inpatient. But I will say this was totally different because the hospital I was at was in the suburbs. So the patients we saw were like a knee replacement, or like they had fallen and they were there because they were like of an older age and they had more complications. Whereas like being in acute care was a totally different story.
Oh, yeah,
Like,
so different.
it's just, yeah, it's like so much more hectic, I guess, because there's like so much going on at the hospital. And like, I felt like it was a much more like calm, chill experience my first time around, but this time was a little bit more of like kind of that pressure that you mentioned, which I think is way better. Like, I would rather be under pressure, because if you can handle that, then you can handle anything.
That's true. Yeah. Going into PT, did you have a desired setting for like your end goal for like your job, or was it outpatient? No, you had no idea.
I was clueless. I think even coming into PT, kind of like what you were saying, I only knew of outpatient, and I thought it was really cool. But then you learn of like how many fields there are, how many specialties that you could go into, and it kind of just like makes you take a step back and think, okay, like what do I really want to go into now? And I still honestly don't know, because as of now, my only experience has been 2 weeks in outpatient. And then I was a rehab aide previously, but I think there's a huge difference between being a rehab aide and actually treating patients in outpatient with that like stress factor. So once I have like another outpatient and like a longer inpatient under my belt where I'm more independent, I'll be able to tell. But I mean, all fields seem great.
Yeah.
I think it's like, we can technically like adapt to any field, which is awesome, but you kind of just have to find like what you would want to do for the rest of your life, or for most of it.
Could you see yourself being an inpatient as like a career?
Yeah, I really liked it. I thought I was going
me
to
too.
not like it. Yeah.
Same.
I remember like being terrified when I started. I was like, because I just thought like these patients are literally putting your life or their life in your hands.
Yeah.
Which is that's not the case for outpatient for the most part. So that was terrifying. I was like, you don't expect like, oh, a patient walking in with like lines and tubes and things attached. You have to like walk around, and so that was definitely the scariest part for me. But I loved it. Like, it was so rewarding. I had a patient, I remember, by the end, and I wish I could visit her now, because she was just so nice.
Oh, the one lady you told me about?
Yeah, so I'll like give a little spiel, but she is a lady with a knee replacement, and she was expecting to like have the knee replacement, go home and be fine. Her course was a little bit more complicated. She didn't get as like strong as we wanted, as fast as we wanted, so she had to spend a few more days and even be referred to subacute rehab. But in that time of like helping her was she was like the most motivated person. Like she was like your ideal patient. And I remember she was like thank you. And that was just like so sweet, because you have so many patients who like hate you for being there and making them get out of bed, and I totally understand. But that was just really sweet and grounding to be like, to understand that you're literally impacting someone's ability to walk, and like their ability to walk is like what they use to like
to
visit
live.
their families. Yeah, seriously, like get groceries, like do anything like you need to kind of maybe go into that. I really liked it a lot, but I would have to see how my outpatient goes.
Yeah, for sure. Now, our school is kind of unique because I know our first clinical is 2 weeks and then the rest are all 12. I don't know. Do you know anyone else in any other programs, like how they have it set up?
Not really.
How do you feel about the 2 week?
At first I thought it was going to be kind of like useless. I don't know about you, but I kind of thought like, what can you get done in 2 weeks?
Yeah.
Especially an inpatient, but I thought it was super helpful.
I did too.
Like, yeah, and especially an inpatient, like getting to see, because that was right before we had our like lab values, like pathology course. So to kind of see like all those things happening in real time, and then you like start studying it, and then you're like, oh, I remember the patient had this. Like, even though it might not make sense in the moment, it's like super helpful for later on. So I feel like whether you're an outpatient or inpatient, it's actually really nice to have that little like dabble. And like both of us, like we did way more than we thought we were.
Oh yeah, oh my gosh. I remember like beginning we were just shadowing, and then by end of like week 1, beginning of week 2, we were doing evals like on our own pretty much. And then I talked to some of our classmates that are an outpatient, and some of them are pretty much just aides, so they didn't really do much. And I'm just like, wow, the experiences vary. But I feel like with inpatient, that freedom, it's kind of like the same progression if you have, no matter what, if you're an inpatient. Like you'll eventually probably have that independence, which I really like.
No, that was awesome. We were basically treating by the end. Like, obviously treating much more low-level patients. I'm not going to say we were great. We weren't.
We're the best. We're ready to graduate.
No, definitely so much to work on. But, like, just to have that independence with, like, a much more low-level patient even. Like, I remember our CI, we had, like, one CI for the last day. And we were kind of both in, like, next-door rooms, like, each with a patient. Which was awesome, because it was like, okay, I can do this. Like, I can handle it, obviously to a much lower extent, but that was really cool.
Do you have any tips for anyone that's like about to enter their clinicals, or like their first clinical for the first time, like a first year or something?
Yes. First, ask a lot of questions, and don't be afraid if they sound stupid, because sometimes the questions that you think will sound stupid are actually like foundational good questions to ask. And if you don't ask then, when are you going to ask, So just get them out, like anything. Because I feel like that helped a lot, is like, even when like my CI would use a term that might have been basic to her, like she's like, oh, we're going to go grab the Sarah study. And I was like, sounds like I should know what that is. Like the way she said it was so casually. And I could have easily just like not said anything, but I was like, oh, what is that? And she was like, oh, like you haven't used it, it's this device, and explained it to me. So it's like, don't be afraid to like ask about even things that like they may brush off and sound common. And then I'm trying to think what else I could, like, advice.
I mean, we only had one clinical, but like,
feedback. For sure. So like obviously like study when you can and like look at research and stuff. But I think the most important thing that helped me grow was getting feedback. If you're never going to be perfect, like accept that. And that's like good. I always like getting 1 or 2 things to work on, because that means that I can like work on them and then show that I worked on them.
Yeah.
So I feel like you're not supposed to like go in and have no feedback of anything wrong. That's pointless. So yeah, I would just like be open with feedback, let your CI know. And like some ways to do it is simply by asking like, what did you think I could do better? What did I do well? What could I do better? And usually the CI will like prefer it if first you start. I would say like, this is what I thought went well. This is what I thought I could do better on. What are your opinions? And that's like, it just shows that like you're taking initiative and that you can evaluate yourself and see what level you're at. And then it gives them an opportunity to like give their advice and help you grow.
Yeah, definitely. And also, like, one thing is, like, I know we only had 2 weeks, but building that CI relationship is super critical.
Mm-hmm.
Understanding how they work and understanding how you work and how you guys can work together. Like you said, like getting that feedback, picking their brains, seeing how they would have done things,
Mm-hmm.
and then just learning from them. Just really just pay attention to how they would do things because they are there to teach you. So
definitely. Yeah. And like make sure with that you're staying professional. Even after like a week or something, you feel like comfortable with your CI, which is good, but like there's still a professional who's going to be evaluating you. Like they're not your best friend. Like don't like gossip, don't do anything that would jeopardize like your relationship with them. And like yeah, just like always remember, like maintain professionalism when you're in that setting for sure.
Yeah. Cool. Well, Shar, I think that's gonna be it. Thank you so much for joining me and helping me out with this podcast today.
Of course.
All right, and thanks guys for listening, and I'll catch you guys next time. Thanks guys for tuning in to today's episode of Broken Stressed. If you enjoyed the podcast, make sure to smash that follow or subscribe button to get notified whenever new episodes are released. If you want to connect with me on social media, you can find me on YouTube or Instagram. Thanks again guys for tuning in, and I'll see you next time.